among this 300 milliosmol, okay, 275, not 275, 270 comes from sodium, and plasma protein contributes only to 0.75. So all the other things, like all the other anions, cations, and all the other proteins, all the other things, okay, that contributes to 300 minus 270 plus 0.5. So all the other substances inside the plasma contribute to the other amount. Plasma proteins contribute to only 0.75 milliosmol from this 300, and sodium is the most responsible one. So these things are mainly for your MCQs. Choto choto MCQ tomader porikha thake, and also in practical you have OSPE. So here these questions can be asked. Egulo choto short note er jonno. And also you have to know about what are different kind of solutions we use in case of treating the patients. So you have to know about what is isotonic solution. Egulo shobi tomra age porecho. All of these things you have studied previously. What is isotonic solution? The solution which are at the same pH of your body level. Isotonicity. So the tone is same. Okay? কেউ ওখানে কথা বলছে, আমি দেখতে পেলে ক্লাস থেকে বাইরে বার করে দেবো। ওকে, সকালবেলা এখানে আমি তোমাদের কথা শোনার জন্য আসি না। ইট শুড বি অপোজিট, তোমরা আমার কথা শোনার জন্য আসবে। তো প্লিজ ডোন্ট টক অ্যামং ইয়োরসেলভস, এন্ড ইফ ইউ ডু প্লিজ ডোন্ট ডিস্টার্ব মি। আস্তে আস্তে কথা বল। নেক্সট, এটা বাজার নয়। তো নেক্সট, isotonic solution is the solution, any solution which is at the same tone of your body fluid, okay, so that if you put this isotonic fluid inside your body, okay, your body or your cell structure, cellular structures will not be hampered. Now if we don't put this isotonic solution, if you put hypertonic or hypotonic solution inside your body, there will be certain effects, okay, so সেগুলো তোমাদেরকে একটু জানতে হবে. You have to know a little bit about that. So isotonic solution is actually very important for maintaining the shape of the particles inside the solution. So this is important for maintaining the shape of particles inside the solution. Shape যদি ঠিক রাখতে হয়, if we want to keep the particles shape right, we have to put isotonic solution. So normal isotonic solution which we commonly, very commonly use, এগুলো কোশ্চেন আসতে পারে, কি আছে বলো? Sodium chloride, but not of all percentage, 0.9% NaCl, এগুলো তোমরা অলরেডি জানো। সোডিয়াম ক্লোরাইড সলিউশন, দ্যাট ইজ ইয়োর সোডিয়াম ক্লোরাইড এরকম পাউচ থাকে 100 ml, 500 ml, 10 ml, ওকে, এরকম ছোট ছোট পাউচ থাকে। দোজ পাউচেস উই ইউজ অ্যাজ ব্যাগস। আমরা চ্যানেল দিয়ে, উইথ দ্য হেল্প অফ চ্যানেল উই পুট দোজ ফ্লুইড ইনসাইড আওয়ার ভেন্স। তো এইভাবে আমরা মেনটেন করি। সো নেক্সট, isotonic solution. So if you put isotonic solution inside your blood, okay, আমরা ভেনে দিচ্ছি, so it goes inside your blood. So if the solution is isotonic, if the solution is 0.9% NaCl, it will not affect the shape of the RBCs and other cells present inside this plasma volume, right, or fluid volume or blood volume. Then what if you put hypertonic solution? Hypertonic solution, okay, one example of hypertonic solution, that is your mannitol. Mannitol is hypertonic solution, okay, mannitol is hypertonic solution, right? So কি হবে? RBC will shrink. Hypertonic, any hypertonic solution, the RBC will shrink, because since the solution is hypertonic, all the fluid from this RBC, okay, normally RBC shape এরকম হয় না, RBC shape এরকম হয়, so all the fluid from this RBC will be getting out into the lumen of the vessels. So these are the fluids, okay, so যদি fluids গুলো, if all the fluids are taken out from the RBC, the cell will shrink. So if you put mannitol or any kind of hypertonic solution, so is this hypertonic solution, your RBCs and the cells, mainly why RBCs আমি কেন বারবার বলছি, because RBCs are the most number of cells which are present inside your blood volume, so the RBCs are mostly will shrink. But if you put, so this is your hypertonic, if you put hypotonic solution, then the RBCs will swell. Similarly, then they will, since this is a hypotonic solution, so fluid will be absorbed, okay, fluid will be absorbed, it will be in the opposite direction. Simple, very simple, mirror image of your putting inside a hypotonic solution, hypertonic solution. So hypotonic এ কি হবে? The cell will be swelled, cell shape এরকম ভাবে বেড়ে যাবে, because of the accumulation of all the fluids which is taken from, this is RBC, so this is your blood vessel. So inside the blood vessel, the extra fluids that will be taken inside your cell, and ultimately the cell will burst. Okay, if this is uncontrolled reaction, the cell will ultimately burst and the RBCs will be affected. So this is hypotonic example of hypotonic solution, that is your urea. ঠিক আছে, urea. This is example of your hypotonic solution. So এগুলো basic ছোট ছোট question. Okay, these questions can be asked in the MCQ or in 2 number marks or something like that. Explain why questions. If you put an hypotonic solution or hypertonic solution, what will be the effects? এরকম করে তোমাকে explain why question ও জিজ্ঞেস করতে পারে। And also short notes can be given in case of value of plasma osmolarity, contributing factors, most contributing factors like sodium, এসবগুলো দিয়ে they can ask smaller questions for you. ঠিক আছে? So now safety factor for edema. What is edema? I have already told you in previous class, that is accumulation of fluids in interstitial spaces. Already I have told you in previous class. Ki hoy, from the blood vessels the fluid is taken out. From the blood vessels the fluid is taken out, and then the fluid is taken out into the interstitial spaces. Now interstitial spaces, they cannot expand much. Since they are interstitial, they cannot expand much. So ki hobe, fluid accumulation hole the area will not be expanded, but fluid is accumulated. So ki hobe, swell hoye jabe. The fluid will be accumulated not inside but on the interstitial spaces of the cells. The cells will be there and the fluid will be accumulated in the middle of it, ultimately swelling your fluid compartment and causing swelling of your body. But you have to provide some safety factors. Okay, body has some safety factors. This edema, whatever we notice, okay, they don't appear at the first time. At the first time the accumulation of fluid is happening, prothomei ora joma hoy na. First, body has some defense mechanisms. So body will have some mechanisms. Body will try to negate this accumulation of fluid. After that, if it is uncontrolled, only then we will be noticing the symptoms of it. So edema, accumulation of fluids in interstitial spaces. Oneke ota ekhon use kore na, that was previous spelling. Oneke ekhon only e diyeo lekhe. So whatever spelling you write is right. Okay, edema. Now next, interstitial. Already I have told you that interstitial space, okay, these are cells. So these interstitial spaces, fluid are accumulated here like that. So these spaces are very much less distensible. Okay, very much less distensible. So the safety factor here is, safety factor means the pressure. The pressure body is able to negate. So during this, in these interstitial spaces, the body is able to negate a pressure of 3 mmHg. Okay, now this is the first factor, interstitial space factor. Okay, safety factor for edema, the factors which controls your edema or accumulation of fluid in interstitial spaces. First, these interstitial spaces are not distendable or non-distensible bolte paro. Okay, or not distendable, whatever term you are comfortable with. But finally, the pressure here, they can absorb about 3 millimeter of mercury pressure. Second factor for safety factor for edema is your colloid oncotic pressure. Like I have already told you, this colloid oncotic pressure are due to proteins. Colloid oncotic pressure are due to proteins. Now this colloid oncotic pressure is the major factor for reabsorption of fluids, right? So what does this colloid oncotic pressure produce? They will increase your lymph nodal flow. So this increase in lymph nodal flow, okay, they will, what will they do? They will mobilize, this lymph nodal flow will mobilize these fluids and they will take out some fluids. So this lymph nodal flow can adjust about 7 millimeter of pressure. By taking out this interstitial fluid, they can absorb about 7 millimeter of mercury pressure. So that is your second factor. And third, due to this increased lymph nodal flow ultimately কি হবে protein wash out হবে due to increase in this lymph nodal flow the proteins will also be washed out. So third is protein wash out. Okay, protein wash out from where? From this interstitial spaces, from interstitial spaces. এই যে এখান থেকে যে ফ্লুইড গুলো আছে the fluid accumulating is taken out in the lymph nodal flow. Okay, so for that 7 millimeter Hg is pressure is taken out. Okay, then with this lymph nodal fluid flow there will also be protein wash out from the same area. যে fluid গুলো এখান থেকে বেরিয়ে যাচ্ছে the fluids that are exerting from here they will also have protein with them. So protein wash out from interstitial space will also happen. So this protein wash out ultimately will be causing your reabsorption of fluid. So whatever I told you, first this interstitial fluid, okay, interstitial space itself has 3 millimeter of Hg. Okay, next is colloid oncotic pressure, major factor for reabsorption. Now what do you mean by reabsorption? এখানে blood vessels আছে, okay, and so reabsorption মানে all these fluids are getting inside this flow from by lymph node 1 and secondly by your protein wash out. So proteins are also washed out, proteins are also going inside your vessels, washing out from the interstitial space. Okay, so কি হচ্ছে দেখো fluid is reabsorbing, right? So এখান থেকে আমার fluid volume কমছে from directly from lymph nodal flow and also due to protein wash out. So this protein wash out will also have another negative effect of 7 millimeter mercury. So your body has total of কত হলো 27 আর 14 আর 3 17. So 17 millimeter Hg is your body's safety mechanism for compensating for starting of edema, not starting, development of edema. Okay, so after your interstitial fluid reaches or maxes out this pressure, then what will happen? The body will not be able to adjust. Body can adjust up to 70 millimeter of mercury pressure in these spaces, but when the pressure exceeds that level, what will happen? The fluid will not be able to get into inside and managed by your own body. Only then you will be noticing the starting of the or development of the swelling. Okay, so this is your negating factor or safety factor for development of edema. জিজ্ঞেস করতে পারে, কোশ্চেন আসতে পারে. Okay, it was in your syllabus, so I completed it. So this much was only left, okay, from your previous class. But today we will be moving on to pH and buffer system, and one thing is left, that is apoptosis and programmed cell death. Okay, that will be discussed in your next class. One class left of this general physiology. So totally different subject, cell death and apoptosis, that will be discussed differently, okay, in previous class in details. Today we will be moving into pH and buffer system and we will be completing the system. So what do you mean by pH? pH এর নরমাল ভ্যালু কত বলো, তোমরা এগুলো সব পড়ে এসছো, বলো তাড়াতাড়ি বলো, নরমাল ভ্যালু pH কত হয় বলো? সে কি নিট ইউজিতে জিজ্ঞেস করে না? বলো। হ্যাঁ 7.35 to 7.45, রাইট, ঠিক আছে। ইউজিতে তো জিজ্ঞেস করে, এ কি তোমরা পরীক্ষা দাওনি? এটা বেসিক করে তো এই ক্লাস 8 এ পড়ায়, যাই হোক জানা উচিত। 8 থেকে 12 হয়ে গেল, অনেক বড় হয়ে গেলে। pH is 7.35 to 7.45. That is your normal range, very small range, right? So next is your, so you have to understand what is fatal, at which pH the body is fatal. Okay, so বাড়লেও fatal হতে পারে, it can be fatal when the pH is decreased. When the pH is decreased, what will we call it? Acidosis. And if the pH is increased, what will we call it? Alkalosis. এগুলো সব তোমরা জানো। So next, the fatal limit is your, লেখো, greater than 7.8. 7.8 যদি হয়ে যায়, or that much alkalosis can be fatal. and also if it goes below your 6.9, it is also fatal. So what he was talking about 7.3 to 7.45, 7.3 is very close to fatal limit. Okay, pH is very sensitive subject. Okay, very sensitive subject and very sensitive values they have, such small limits. Okay, so change in even 0.1 is very much significant. Okay, so remember it, 7.35 to 7.45, fatal limit is more than 7.8 or less than 6.9, that is your fatal value. So next is we'll be discussing about how this pH is controlled or monitored in our body or regulated in our body, however term you are comfortable with you can use. So by buffers, eদেরকে আমরা বলছি buffers. So these buffers are actually what? Buffers are actually in body for maintenance of pH, because maintenance of pH is very important for all the cellular functions and all the bodily functions to be done. So there are three line of defenses. First line of defense, second line of defense, and the final or third line of defense. Whenever there is a pH change in our body reacts automatically. Why? Because body tries to maintain homeostasis. সেই জন্য body will negate these changes in pH, so the body is all right. So first line of defense comes from these buffers. Second line of defense will come from your lungs. Lungs and CO2 will form your second line of defense, and the final line of defense to maintain your pH is your most important organ, সেটা হচ্ছে kidney. So kidney via excretion, absorption and reabsorption, all those procedure happens in PCT, DCT, collecting tube, okay, loop of Henry, all of these things. So the three line of defense to maintain pH are first line as buffers. So we'll be discussing buffers. We'll be discussing the second line, how lungs and CO2 maintains it, and third, how the kidney maintains it. So these are the three line of defense. So lungs mechanism involves CO2 and kidney mechanism involves two very important ions, that are H plus and bicarb. So by excreting these two ions, kidney maintains your buffer, pH, and by excreting or taking CO2, the lung will maintain your pH, right? So কিভাবে করে এবার আমরা এভাবে ডিসকাস করব। হাউ আমরা তো বলে দিলাম করে, কিভাবে করে the mechanism you have to know, that is your basic physiology. So এটাই আমরা আজকে জিজ্ঞেস করব। Okay, so what is the importance of maintaining pH? Okay, like I have said ki they tries to maintain pH. Now why will body fatal holo eta to ami manlam, but even if it's not fatal, okay, then what is the need of maintaining pH? Okay, so কি হয় আমি অলরেডি বলেছি বডিতে অনেক সমস্যা হবে, there will be problems in our body, but what are the problems, what will be the problems we'll be facing? First is whenever this pH value is deranged, the cellular proteins, okay, cellular proteins will be hampered. So protein denaturation happens whenever there is pH change. So pH change leads to protein denaturation. If protein denaturation occurs, কি হবে? These proteins are actually mostly things, hormones, enzymes, all of those things, most of these things are proteins. So all of the protein function will be hampered. Protein function hampered হলে কি হবে? Enzyme activity will be hampered. So enzyme activity will be less. That's so if the enzyme activity is less, bodily function will just degrade and deteriorate and ultimately break down. Okay, so এটাই হচ্ছে main importance of maintaining the pH. All the enzyme activities of our enzymes are very important factors in our body, so all the enzyme activities will be hampered. So that's why this pH maintenance is very important. So pH change brings this calamity in our body. So most important now, কিছু question, short question is very important. Most important buffer, okay, in extracellular fluid. So most important buffer in extracellular fluid are most important buffer in extracellular fluid. Extracellular fluid মানে just the things we discussed today, interstitial fluid and the blood volume or plasma volume. আগের দিন আমি অলরেডি ওখানে পড়েছিলাম ECF equal to this plus this and all of that were taught in previous day. So most important buffer in ECF is your হচ্ছে bicarb. Most important buffer is bicarb. Okay, why? Because this carbon dioxide and hydrogen both are so tightly regulated. Okay, only the presence of bicarb is the most important. They are tightly regulated. Bicarb is not tightly regulated. Okay, so the bicarb is the most important buffer. Okay, it can change a lot of things in our body related to pH. So and also we have to understand, so this is most important but not most plentiful. Most plentiful means the buffer which is present in the most amount. So most plentiful buffer, okay, in our body is ICF. In our body means in intracellular. So extracellular fluid আমরা দেখে নিয়েছি. In intracellular fluid most plentiful buffer is your proteins. Intracellular proteins I have already talked in previous classes. Okay, protein anions আমাদের সেলের মধ্যে থাকে, intracellular space এ থাকে those protein anions. So these proteins, intracellular protein anions, are the most plentiful intracellular buffer. So extracellular buffer most important bicarb, other two are your carbon dioxide and hydrogen, and intracellularly your most important and most plentiful buffers are proteins, those protein anions. ঠিক আছে, these are for your short notes and basic questions, right? So what makes this protein maintain this buffer? Presence of one amino acid called histidine. Okay, so with the help of amino acids and this presence of this histidine is actually very important for these proteins to be able to maintain buffer. Histidine না থাকলে প্রোটিনরা বাফার মেইনটেইন করতে পারবে না. If there is no histidine, the proteins will not be able to maintain this buffer. So presence of proteins and also most plentiful in extracellular fluid. So most important in extracellular fluid is bicarb, but most plentiful in extracellular fluid is your, easy to understand, সবচেয়ে বেশি extracellular fluid which is there, hemoglobin. So the RBCs are the most plentiful. They are most in numbers which can act as buffers in extracellular fluid. So plentiful extracellular fluid are most important alada. They are different. Okay, bicarb is the most important buffer in ECF. RBCs are the most plentiful buffers in ECF. Right? এগুলো short note আসতে পারে. And also there are other buffers. Another intercellular buffer is phosphate and urinary buffer. Okay, urinary buffer, other urinary buffers. Urinary buffer already আমরা দুটো দেখেছি যেখানে আমরা কিডনিতে কাজে লাগে, হাইড্রোজেন and bicarb. Another very important urinary buffer is your ammonia. Very important buffer in your urinary system or urinary buffer ওটাকে আমরা বলি, because they come in action only in your urinary, not urinary tract, in your kidneys. So that's why ammonia is another urinary, very important urinary buffer. How it's important একটু পরে আমরা will be studying a few mechanisms. ওখানে আমরা দেখব কিভাবে এরা কাজ করছে, ওখানে বুঝতে পারবে কেন. ঠিক আছে, so next, so first line of defense actually are buffers. So we have discussed what are the different buffers and all. Now second line of defense means your lungs and CO2. So how this second line of defense maintains your pH? Okay, we'll be discussing that. So regulation of pH এখন আমরা ঢুকে যাব. Buffers are completed, not much. Intercellular buffers, extracellular buffers, first line, second line, ये सब मैंने कह दिया. Then we'll be moving into this buffers, আমরা basic জেনেছি. Then we'll be moving on to second line of defense, that means lungs and CO2. How the CO2 in lungs are affecting your pH. কি হচ্ছে second line of defense? You have to understand in lungs, okay, alveolar ventilation is inversely proportional to the PCO2 level. এটা তোমরা বুঝতেই পারছো, जितना ज्यादा ventilation होगा, okay, जितना ज्यादा ventilation होगा उतना CO2 तुम्हें बाहर आ जाएगी, और जितना कम ventilation होगा उतना CO2 अंदर रह जाएगा, right? So alveolar ventilation is inversely proportional to PCO2 or the CO2 in our present in our body. So PCO2, the CO2 pressure, जितना ज़्यादा होगा ventilation उतना कम होगा. So that is the relation, and by this relation and by this principle, the buffer is maintained in your lungs. কিভাবে হয়? So whenever you are hyperventilating, so case 1 hyperventilation. Case 1 is hyperventilation. So whenever you are hyperventilating, কি হবে? In hyperventilation, you also know CO2 wash out হয়, তো increase rate হবে of respiration, of course, increase rate of respiration, and also increase the depth of respiration. So hyperventilation means increase in both rate and depth of respiration, and finally that will be leading to CO2 washout from our lungs. That will be leading to CO2 washout from our lungs. So whenever CO2 will be washing out, PCO2 কি হবে? কমবে. PCO2 will decrease. Okay, so PCO2 will decrease. So that is the first line of maintenance. Second is whenever we are hypoventilating. Okay, in case of hypoventilation, the opposite thing will happen. What will happen? CO2 accumulation হবে. You are hypoventilating, mean your ventilation is not done properly, so oxygen inhalation and CO2 excretion will not be able to be done properly. So CO2 will be accumulated inside your lungs. So CO2 accumulation, which in result will ultimately increase your PaCO2 level. So increase in PaCO2 level will ultimately, now তুমি বলতেই পারো স্যার কেন? Now the CO2 with water will be forming H2CO3, okay, with help of carbonic anhydrase. এটা আমরা এক্ষুনি লিখবো. But now this happens in kidney. Ultimately, with the help of carbonic anhydrase, this CO2 will combine with H2O and form H2CO3, which again will dissolve into H2O plus CO2. So this increase in CO2 level is very important for the formation of bicarb and hydrogen in kidneys. So the increase or decrease in CO2 will be controlling that also. Okay, so increase in CO2 or decrease in CO2 can control the levels of hydrogen and bicarbs in our body. That's why the PCO2 and the level is important for maintaining your pH. কারণ যদি এগুলো চেঞ্জ হয়, এগুলোও চেঞ্জ হয়ে যাবে, and the values will be different. So this is the second line of defense. If by buffers it is not maintained, the pH is not be able to maintain properly, the alveolar ventilation comes into action. Either hyperventilation হবে or hypoventilation হবে. If the CO2 in body is less, তাহলে কি হবে? আমার hypoventilation হবে to accumulate the CO2 inside your body. But if the PCO2 has already increased in our body, then the person will be hyperventilating so that the extra CO2 will be washed out from your lungs. So this is your second line of defense. Now third line of defense, how this CO2 is coming into action actually. Why is this PCO2 important? এটা তোমরা বুঝতে পারবে, that you will understand how the third line of function works, like in kidney. So in kidney, তিনটে এরকম ছবি আঁকো. On the left, draw your peritubular capillaries. So here, draw peritubular capillaries. Now this is your PCT. So this is your peritubular capillaries. Okay. This is your PCT. PCT means proximal convoluted tubule. And here is your lumen, urinary lumen. Okay. That means you're collecting that. Before collecting that, the urinary lumen ta thake. So that is your urinary lumen, right? So whatever happens, it will happen between these three. So এখন আমরা তাহলে ঢুকে যাচ্ছি কোথায়? We are entering the third line of pH maintenance, that is your renal maintenance. Alveolar maintenance আমরা দেখে নিয়েছি. Now we'll be going into renal maintenance. How does the kidney maintain it? So kidney actually does these things by 1, 2, 3 or 4 mechanisms. So what are those mechanisms? First you have to know about the mechanism. Ki hoy? First, hydrogen ion excretion. Second is your bicarb excretion. Like I said, hydrogen and bicarbonate were two important factors. Third is your reabsorption. So bicarbonate reabsorption. And four is your generation of new bicarbonate. So new bicarb regeneration. So বোঝা গেল why bicarb is the most important extracellular buffer. দেখো, only in kidney, only hydrogen excretion is the factor which is controlled by hydrogen, but bicarb excretion, bicarb reabsorption and new bicarb regeneration, okay, all of these things are very important kidney functions so that the pH can be maintained. So that's why bicarb is the most important extracellular buffer. Okay, I have already told you in that area. Now why, you understand by this diagram. So these 4 mechanisms we will be discussing one by one. Ki kore konta hoy? Okay, sometimes these things can happen simultaneously. Okay, so ek ek kore amra dekhbo je ki hocche. So first is hydrogen excretion, bicarb reabsorption, okay, and bicarb excretion. These 3 things happen simultaneously and also together. এখানে আমরা ফার্স্ট এখানে দেখব. So first function, first, second and third function we will be seeing together. Okay, hydrogen excretion, bicarb excretion and bicarb reabsorption কিভাবে হচ্ছে. Then in second point we will be discussing how new bicarb is formed. So this 4 mechanism is very important. কি হচ্ছে দেখো এখানে. এবারে প্রথম দেখো, just like I said, CO2 plus H2O with the help of carbonic anhydrase is forming your H2CO3, which is actually unstable. So ওটা সঙ্গে সঙ্গে কি করবে বলো, কি করবে তাড়াতাড়ি বলো. H++ এটা হবে. So this is happening inside your PCT, right? So with the help of carbonic anhydrase, very important, hydrogen and bicarb formation. Now this hydrogen and bicarb will be moved along either in this way or in this way. Okay, so এখানেই আমরা absorption, reabsorption and excretion. If এরা যদি এখানে চলে যায় আমরা কি বলবো, excretion, because দেখো urinary lumen, they have gone into urinary lumen, so they are excreted. If they get into this peritubular capillaries, that will be called reabsorption, because they are reabsorbed. Okay, and they can also be reabsorbed from this urinary lumen to PCT also. So reabsorption can occur both ways and excretion can occur in this way. Whenever they are going into hydrogen hote pare, bicarb hote pare, whenever they are going into urinary lumen, you will call it as excretion, because ultimately urinary lumen দিয়ে বেরিয়ে চলে যাবে. Reabsorption can occur from PCT to capillary or from urinary lumen to this PCT. ঠিক আছে, সো রিঅ্যাবজর্পশন এন্ড এক্সক্রিশন, এবার এগুলো আমরা একসাথে উইল ডিসকাস ইট টুগেদার কিভাবে কোনটা হচ্ছে. সো কি হয়, ফার্স্ট দিস bicarb, okay, can be reabsorbed here, can be reabsorbed here. So that is your reabsorption of bicarb mechanism. Okay, first mechanism, sorry, here আমি কোনে third এ লিখেছিলাম. This is your third mechanism. Now this hydrogen কি হবে, now here comes two very important things already I have discussed in previous classes. Now how is this bicarb and hydrogen, all of these things are absorbed and reabsorbed? Not easily, they are done with the help of exchanger proteins or some specific proteins like ATPase. Okay, so those proteins will be helping into these mechanisms. So কি হবে, first is your এখানে sodium hydrogen exchanger. This is your sodium hydrogen exchanger. নাম শুনেই বুঝতে পারছো কি হবে। This is example of Antiporter. আগের দিনই বলেছিলাম when two substances move in opposite direction, like ওখানে আমরা হেল্প দিয়েছিলাম chloride and bicarb exchanger এর আমরা এক্সাম্পল দিয়েছিলাম, রাইট? সো সোডিয়াম হাইড্রোজেন এক্সচেঞ্জার, so here what will happen, one sodium will come inside from here to there, so sodium reabsorption will occur and this hydrogen, this formed hydrogen will go into this area, but এরা নিজেরা যেতে পারে না, they will be gone with the help of this sodium hydrogen exchanger pump, that is a protein. Okay, so hydrogen, so that way first hydrogen is excreted in your urinary lumen, so ওখানে চলে গিয়ে বেরিয়ে চলে যাবে। So now this hydrogen has gone into your urinary lumen. Now next, if this urine has least this hydrogen level, okay, beyond repair, মানে যদি আমরা, now if you think about it, this hydrogen is getting into urinary lumen. Now urinary lumen acidosis তো হয়ে যেতে পারে, there can be urinary lumen acidosis because of accumulation of acids, তো সেখানে কি করতে হবে, ব্যালেন্স করতে হবে। To balance urinary lumen acidosis, sometimes what they do, they keep it with bicarb. Now this bicarb and this excreted hydrogen, since there is acidosis, so acidosis is an unwanted hydrogen, if this goes out and if it goes out from lumen to the outside, there won't be any problem, but if there is accumulation of hydrogen, then there can be problematic sequences. So what will happen, if there is urinary lumen acidosis, this excreted hydrogen, this excess hydrogen present in urinary lumen will react with bicarb with the help of সবাই জানে carbonic anhydrase, and again they will be forming your by H2CO3, and finally they will be forming H2O plus CO2. That's how during this hydrogen excretion, if by any chance urinary lumen acidosis is observed, this way they can negate that urinary lumen acidosis by reacting this, making this hydrogen react with another bicarb ion, okay, then finally forming water and carbon dioxide. So this is how, now this carbon dioxide will again be reabsorbed into this PCT, and this water will also be going into this area, so this is a circle, this is a circle, আবার ওরা ওখান থেকে এখানে আসবে, same reaction will happen here, hydrogen bicarb, hydrogen will be getting inside this area, okay, bicarb will be either reabsorbed or it can go into this area if there is excess hydrogen, then to negate that এই bicarbonate আবার ওখানে চলে যাবে, okay, to negate that normally bicarb is reabsorbed, but if there is urinary lumen acidosis by excess accumulation, হয়তো যে at which rate, sometimes it can happen the rate by which the hydrogen is going into urinary lumen, the excretion is not happening at that rate, so কি হবে, H phase accumulate হতে পারে, accumulation হয়ে গেলে this bicarb will go into this area and they will react, again they will then perform this circle. So that is how hydrogen excretion, bicarb excretion or bicarb reabsorption, by these three mechanisms they try to maintain the balance. So this is your sodium hydrogen exchanger present in your proximal convoluted tubule that helps in this exchange, okay. So first, now this is the first point, all the three things are actually happening together according to the bodily need, right? So in second case, second scenario, accumulation of new bicarbonate or development of new bicarb. Now this bicarb which is coming into in this area, okay, reabsorbed into this area, that is no new bicarb. দেখো carbon dioxide and hydrogen that were present previously, they are getting this bicarb, so that is not newly generated bicarb, that is reabsorbed, that is actually coming from this old thing, so this bicarb is not newly generated, we will call it reabsorbed bicarbonate when it comes into this area, and we will call it excreted bicarbonate when it comes into this area to either go outside by his own or to maintain or negate the acidosis if needed. So by these three mechanisms are discussed together here, not discussed together, they actually happens together also, এতক্ষণে নিশ্চয়ই তোমরা বুঝে গেছো, what is this peritubular capillaries, what is this urinary lumen, what is this your PCT, and the most important enzyme here is carbonic anhydrase and সোডিয়াম হাইড্রোজেন এক্সচেঞ্জার। ইফ দে আর নট প্রেজেন্ট এইগুলো হতেই পারবে না, ঠিক আছে। সো any problem in this hydrogen exchanger or any protein deficiency that will also cause this kidney not to maintain the pH level, কারণ যদি এক্সচেঞ্জার নাই থাকে কি করে ওদিকে যাবে, যেতেই পারবে না। সো দ্যাটস ওয়াই দিস প্রোটিনস আর অলসো ভেরি ইম্পর্টেন্ট। সেই জন্যই ওখানে প্রথমেই আমরা বলছিলাম যে প্রোটিন ডিন্যাচুরেশন হয়ে গেলে all the enzymes, all the pumps, they will be not acting properly, so maintenance of pH is already hampered. So already pH level change হওয়ার জন্য, already due to change of pH level, your proteins are hampered, and if your proteins are hampered, it is, you know, even more defective to your pH. So that is a, এটাকে কি বলবো আমরা, বলো আমরা, নেগেটিভ ফিডব্যাক, পজিটিভ ফিডব্যাক, দ্যাট ইজ পজিটিভ ফিডব্যাক। যত এদিকে হচ্ছে তত ওদিকে হয়ে যাচ্ছে, ঠিক আছে। সো দ্যাট ইজ অ্যানাদার এক্সাম্পল অফ পজিটিভ ফিডব্যাক মেকানিজম। ওকে, বাট এটা অফিসিয়াল এক্সাম্পল তোমরা লিখবে না, তোমরা যেগুলো ইজি সেগুলো লিখবে, কারণ ইফ ইউ রাইট দিস ইউ হ্যাভ টু এগেন এক্সপ্লেন অল দিস থিংস। ওকে, সো ইউ ক্যান সে দিস ইজ অ্যানাদার এক্সাম্পল। So already your pH changes are degrading proteins. Protein degradation will be resulting into more pH imbalance. Because the exchangers, all of this will not work properly na. So এটা হচ্ছে একটা positive feedback বলতে পারো, not positive for our body but positive due to the mechanism. In case of our body, that is not even negative, that's death sentence. pH because একটু চেঞ্জ হলে দেখতে পাচ্ছ 7.39 is your fatality level. So একটু এদিক ওদিক হলে হয়ে গেল। নেক্সট, জেনারেশন অফ নিউ বাইকার্বনেট, লেখো 4 নাম্বার, ঠিক আছে, সময় আছে। জেনারেশন অফ নিউ বাইকার্বস। This is a very important mechanism. কি হয়, in case in PCT, very important mechanism occurs, that is your glutamate metabolism. Glutamate or glutamine, you can say anything, glutamine. So here very important factor occurs, that is glutamate metabolism. Glutamate metabolism occurs in your PCT. So this glutamine actually কি করবে, they during this metabolism procedure have their side products. So as this glutamate metabolism or glutamine metabolism side products, what are produced, ammonia, কি produce হয়, 2 bicarbonyls and 1 ammonia, এটা এখানে produce হয়, ঠিক আছে। নাও সেম এখানে কি ছিল, ক্যাপিলারি, আর এখানে কি ছিল, urinary excretory tract. So this is your urine, this is your urinary, okay, urinary area, and this is your capillary, peritubular capillary, okay. So this is your peritubular capillary. Now this is urinary duct. তো এই যে bicarb and ammonia produce হচ্ছে, this bicarb and ammonia both acts as an urinary buffer. ওখানে আমরা বলেছিলাম ammonia is another important urinary buffer, দেখো এখানে produce হচ্ছে, and now you will see how they act. Okay, কিভাবে করবে। Now আমি একদম প্রথমে in our first class or second class একদম প্রথমে কখন আমি বলেছিলাম যে there are actually another transport mechanism, that is non ionic transport. এখানে দেখো সেই জিনিসটাই হচ্ছে, ultimately this ammonia cannot be transported as ammonium ion, ও চেঞ্জ করতে পারবে না। সো দেখো এখানে আরেকটা এক্সাম্পলও পেয়ে যাচ্ছ। তো দ্যাট ইজ দ্য এক্সাম্পল আই ওয়াজ টকিং অ্যাবাউট দ্যাট ডে, নন আয়নিক এক্সচেঞ্জ or non ionic transport. This ammonia will come into this NH3 as this ammonia, then finally কি হবে, এখানকার একটা হাইড্রোজেনের সাথে যোগ হয়ে যাবে, and finally they will form NH4 plus. NH4 plus, this can be excreted. Okay, ammonia, ও তো এখান থেকে অ্যামোনিয়াম আয়ন হয়ে আসতে পারতো, এখান থেকে হাইড্রোজেন নিয়ে, বিকজ হাইড্রোজেন আর প্রেজেন্ট ইন পিসিটি অলসো, বাট এখানেও যদি হয় ও যেতে পারবে না, ট্রান্সপোর্ট হতে পারবে না, বিকজ অ্যামোনিয়া ইজ, অ্যান্ড অলসো আরেকটা কি বলেছিলাম, ভেরিয়াস প্রোটিন অ্যানান্স, দে আর অলসো লার্জ ইন অ্যামাউন্ট, অ্যান্ড অলসো ওরা হচ্ছে গিয়ে আসতে পারে না, সোডিয়াম থায়োসালফেট আরেকটা এক্সাম্পল দিয়েছিলাম অ্যামোনিয়ার সাথে। সো দিস থিংস দে ক্যান নট বি ট্রান্সপোর্টেড অ্যাজ আয়ন্স, তো অ্যাজ এ অ্যামোনিয়া দে গেট ইনটু ইট, দে অ্যাক্ট উইথ দিস বিকজ হাইড্রোজেন, অ্যান্ড দেন দে অ্যামোনিয়া ফর্ম করে ইউরিনের সাথে এক্সক্রিট হয়ে চলে যাবে, ঠিক আছে। দ্যাট ইজ ফার্স্ট মেকানিজম। সেকেন্ড মেকানিজম, কি হয় this bicarb are reabsorbed in your capillary. Now দেখো this bicarb is a side product of glutamate metabolism. Okay, previously by H2O plus CO2, from there the bicarb was coming, and in this case this bicarb is a side product. So এমন নয় যে কার্বন ডাইঅক্সাইড আর হাইড্রোজেন মিশে already these components were not there, that is completely different, a side product. So in this case we can say that this bicarb is newly generated. Why? Because that bicarb if goes into that side, okay, again it will be acting with this H2CO3, again it will be acting with H plus to maintain this H2CO3, then with carbonic anhydrase again they will be breaking down and they come into this area. So it is that previously in previous diagram it was a regulation, so that bicarbonate was not new, whatever bicarbonate was getting from this loop only, but এখানে দেখো কোনো loop নেই, it is a side product, it is totally newly origin. এটাকে যদি এখানে নিয়ে যাও and if they comes back here, they will not have any function in this glutamate metabolism. Glutamate metabolism by themselves will produce another two bicarbonate, irrespective of তোমরা ওটাকে ঘুরিয়ে এখানে যদি নিয়ে চলেও আসো, irrespective of that glutamate with metabolism will release another two bicarbonates. So দেখো that is newly formed bicarbonate, তো এটাকেই আমরা বলছি newly generated bicarbonate which is reabsorbed in the capillary. So that is your fourth point, new bicarb regeneration. Now these bicarbs will be generated. Now according to need, these bicarbs can come into here, or they can be totally reabsorbed, or they can come into here and they can negate all these functions and all, but they are newly generated, they are not part of any loop. Since they are not part of any loop, we are telling them newly generated. Irrespective of the regulation of this bicarbonate, glutamate metabolism itself will newly generate two bicarbonate with its metabolic cycle. So সেখানে আমার কিন্তু এটা newly generated হবে, ঠিক আছে? So this is, and এই যে অ্যামোনিয়া দেখো এখানে হাইড্রোজেনের সাথে মিশছে, so not only ammonia is a toxic product, so it needs to be excreted, but when they are getting excreted কি করছে, একটা হাইড্রোজেনকে নিয়ে যাচ্ছে সাথে as a ammonium ion. Okay, now taking this hydrogen from this area will be decreasing the chances of acidosis in your urinary tract. It's not urinary tract বলছি বারবার, that is your tubule or okay excretory যেটা থাকে pathway সেখানে. So this ammonia is also acting as a buffer, যেটা কি আমরা ওখানে এক্সাম্পল হিসেবে দিয়েছিলাম urinary buffer, not as important as hydrogen or bicarb. So most important bicarb কেন বোঝা গেল, most important সমস্ত জায়গায় bicarb কাজে লাগবে. Hydrogen comes into action in some areas and ammonia comes into action in this metabolism in this area. So ammonia is the least important, but it is also another urinary buffer. Bicarb is the most important, সব জায়গায় আছে, and hydrogen is intermediate. হ্যাঁ, সেই জন্যই আমরা বলেছিলাম most important extracellular buffer is your bicarb. এগুলো extracellular লেভেলে হচ্ছে, in vessels, okay, in tubules, এই সব জায়গায় হচ্ছে, তো extracellular most important buffer is your bicarb. Now another thing, আরেকটা mechanism হয়, this is first mechanism, generation of new curve, that is first mechanism. Second mechanism is not related to glutamate metabolism, but happens in similar cell, but now this third mechanism, first mechanism is from your glutamate metabolism. Generation of new bicarb has two mechanisms, first from glutamate and second from H2PO4. Second from H2PO4, এটাকে কি বলে, হাইড্রোজেন ফসফেট. সো কি হয়, ওকে, দিস আগের পিকচার থেকে মনে করো আমার ওখানে হাইড্রোজেন এই যে এক্সট্রা চলে যাচ্ছিল, ওকে, ফ্রম দ্য প্রিভিয়াস পিকচার দ্য হাইড্রোজেন এই যে এখানে H প্লাস HCO3 মাইনাস হয়েছিল, ওখান থেকে হাইড্রোজেনটা সোডিয়াম হাইড্রোজেন এক্সচেঞ্জার দিয়ে ওখানে চলে যাচ্ছিল, অলরেডি আই হ্যাভ টোল্ড ইউ. সো সেকেন্ড মেকানিজম ইজ দ্যাট excreted sodium, either it will be getting with NH3 and going outside to prevent urinary acidosis, and another thing can happen, arekta buffer er naam amra bolechilam extracellular phosphate buffer. Ki hoy, they can act with phosphate, H plus আর phosphate reaction করলে কি তৈরি হবে, H2PO4. So this H2PO4 is actually formed, and in this case the phosphate buffer is coming into action. ঠিক আছে, now this phosphate buffer is coming into action and new bicarbonate, as usual new bicarbonate will be generated. Okay, new bicarbonate তখনও ওখান থেকে যেগুলো হচ্ছে তারা ওখানে আসছে. So this H2PO4 is another process, hydrogen phosphate is another process, formation of hydrogen phosphate is another process by which this urinary acidosis can be negated. Yes, H plus বাড়ছে মানে acidosis. So H2PO4 is very much titratable. This is titratable. Titratable মানে আমরা এটাকে টাইট্রেট করে বায়োকেমিস্ট্রি কেমিস্ট্রি ল্যাবে তোমরা করেছিলে টাইট্রেশন, ওখানে করে আমরা কালার দিয়ে এটাকে চেক করতে পারি, রাইট? সো অল ইউ হ্যাভ ডান ইন দিস প্রিভিয়াস কেসেস. সো হয়ে গেল এখানে তোমার গল্প এরকম, অ্যান্ড ইন দোট প্রিভিয়াস পিকচার এই যে H প্লাস প্লাস HCO3 যেটা হচ্ছিল, এখানে সোডিয়াম হাইড্রোজেন এক্সচেঞ্জার আছে, সোডিয়াম হাইড্রোজেন এক্সচেঞ্জার আছে, CO2 plus H2O, H2SO3, carbonic anhydrase, then again it breaks down, right? So in that case দেখো হাইড্রোজেন তো আমার এখানে চলে আসছে with the help of exchanger and with the help of phosphate, okay, acidosis is negated. Then what happens to this bicarb? This bicarb is reabsorbed into this area. So how this mechanism is related to newly generation of bicarb, এটা তোমাকে জানতে হবে. So you are thinking sir is talking about phosphate and all, bicarb টা কোথায়? Bicarb is here, okay, this hydrogen is going inside this area, bicarb is there. Now since the hydrogen is not negated by CO2 HCO3 here, okay, since the hydrogen is not negated with HCO3 কি হবে? Another, this loop cannot be formed, this loop cannot be formed. Hydrogen আমার এখানে হাইড্রোজেন ফসফেট হয়ে টাইট্রেটেবল সাবস্টেন্স হয়ে বেরিয়ে চলে আছে. So this hydrogen is not regulated. So bicarb যদি আমার ওখানে যায়ও, if the bicarb even goes there, what will they do? There is no hydrogen to act together, so this loop is not formed. So then this bicarb is reabsorbed into the capillary. এখানেও দেখো newly generated, okay, এখানেও দেখো newly generated. Every time this mechanism happens, if the hydrogen is titrated by phosphate, if the hydrogen is negated and titrated by phosphate, the bicarb has no use there because hydrogen has already been negated. So কি করবে? They will be taken back. So that is also can be called as new generation of bicarbonate. Okay, পুরানো ক্ষেত্রে কি হচ্ছিল, এখানেই আমার আবার ভেঙে যাচ্ছিল, H plus H2 আর CO2 হয়ে যাচ্ছিল. So এখানে তো আমার হাইড্রোজেন ফসফেট হয়ে চলে গেছে, so they cannot act in this mechanism, so the loop is not formed. Okay, no function of CO2, no function of bicarbonate there is needed, so the bicarbonate is taken. So for two mechanism, glutamate দিয়ে আমার কটা bicarb যাচ্ছিল? 2 bicarbs, and this H2PO4 mechanism দিয়ে কটা bicarb যাচ্ছে? একটা. And always remember this bicarb comes from this CO2 plus H2O, H2CO3, and this bicarb, 2 bicarb, this first mechanism comes from glutamate metabolism. বোঝা গেল? So these two, in these two procedure, glutamate metabolism and hydrogen phosphate formation, the generation of new bicarbonate is possible. এই বুঝতে পেরেছো এটা কেন রিসাইকেলেবল নয়? আগের বার যখন হাইড্রোজেনটা এখানে যাচ্ছিল, they were acting with this bicarb, finally forming this, and they were forming a loop. So that was no new bicarbonate, it was getting used. But since here it is not used, every time this mechanism happens, every time hydrogen is titrated with phosphate, the bicarb is useless. That is extra means that is newly generated, যেটা কোনো কাজেই আসছে না, it is not part of any loop. বুঝতে পেরেছো? So এই মেকানিজম গুলো তোমাদের জানতে হবে, very easy to understand, okay, not much difficult. একবার যদি তুমি বুঝে যাও এই ছবিগুলো, it is not difficult at all, very easy. So these three procedure in renal area, in lungs by CO2, and CO2 কেন important এখানে বুঝে গেলে, every time দেখো CO2 কিন্তু এখানে আছে, so CO2 is very important, and this CO2 level will be maintained by your second line of defense, that is your lungs, right? So in this three mechanism, or sorry, by this three mechanism, and yeah, intercalated cell, type B intercalated cell, role of ওকে, সো অ্যাসিড বেড ব্যালেন্স একটা সামান্য ছোট জিনিস আছে যেটা আমরা পরের দিন পড়বো, এন্ড তার সাথে আমরা সেল ডেথ অ্যাপোপ্টোসিস করে জিনিসটা শেষ করে দেবো, ঠিক আছে? সো টুমরো, নট টুমরো, next Saturday will be your last class of general physiology, in which we will be completing how acid bed balance is maintained by your collecting duct. Okay, so here mostly today we have focused on PCT. So next day PCT is done. Next day we'll be focusing on collecting duct, how collecting duct maintains the pH. Okay,